Thank you, Mr. Chairman, for the recognition, and I want to thank the witnesses. I want to thank you not only for your work, but your work during one of the most challenging times in the history of our planet. As I sit here, I was thinking about the physical, the mental, the economic toll that it has taken on all of us, and the fact that there was so much that we did not know. And so I just want to commend you, because I know you're sitting here and getting some very tough questions, but it was also something that we collectively went through and are still going through. I have a family member who died 2 months ago from COVID. So I want us to remember this was unusual, and that even as we ask our questions, that we remember we are still in this together. I'm glad that you brought up workforce needs, data authority, supply chains. These are all things that have impacted every single piece of this, including research and development and innovation. I know in its 76 years, the CDC has never faced a public health emergency of this magnitude. So it's not surprising that there were a lot of lessons learned for all of us. And one of the things that we learned is that the CDC lacked critical data when COVID-19 emerged, resulting in an incomplete national picture of this global threat. I'm glad there were a lot of questions already asked on data authority, but Dr. Walensky, what kinds of questions would data authority allow the CDC to answer? Can you give us a few examples also of how data authority could have helped in federal decision-making?
Sure. What fraction of people in the hospital are vaccinated? What is, now we have these authorities through the public health emergency, but what is going to be our % positivity for testing? In MPOX, before we had all of our data use agreements signed, is who's getting vaccinated? So those are key things as we're in the position to make important decisions. We're making those decisions without the benefit of data that exist, and it makes it harder to make them. Thank you.
I know for me, one of the biggest things that I learned was that there were just basic things like collecting data on race and ethnicity that were not clear, and it ended up being one of the strongest indicators for death and contraction. Can you tell us what steps we're taking to bridge the gaps in data like race and ethnicity, or what more should be done?
Right, so we're working through our data use agreements with each of our individual jurisdictions to be able to receive those data. Oftentimes those data are not fully completed, and so that gives us a limited view as well. But if through our data monetization efforts, we can then standardize the data that are collected and link them, then they would immediately populate.
Thank you. One of the issues that I hope is not lost or forgotten is the issue of long COVID. And I'm glad that that has also been one of the topics of discussion here. I know individuals that are still concerned, struggling. We have healthcare providers that don't really know what to do. And Dr. Tabak, what guidance do you have for healthcare providers trying to understand and treat patients with long COVID now?
At the moment, there are no treatments that we know are effective against all forms of long COVID. What clinicians are doing is they are treating symptoms based upon their similarity in other disease and conditions. We hope to launch the first interventional trials using our RECOVER cohort within the next few months and hopefully get more definitive answers than that one.
I can say I am pleased that I've been working with stakeholders in this space, because I, again, don't want us to forget it. This also, in addition to our health impacts, it has impacts on our economy and jobs and people being able to go to work. I ask unanimous consent to enter into the record a collection of published medical research and scientific literature from the COVID Patient Recovery Alliance. I've asked for permission to enter into the record.
Without objection.
Thank you, Mr. Chairman. I've been working with these stakeholders, and again, as I said, I want to make sure that we don't forget those individuals and that we continue to have a focus there. We will have a lot more questions to enter into the record, but again, thank you so much for your efforts. Again, we are still all in this together. I yield back.
Gentlelady yields back, now recognize